So PROSECO is a study that's led by Southampton. So what we did here is an observational study. So what we did was the study is still ongoing. We take blood from patients before and after their vaccine, their first and second doses, and we're still continuing to do so. And in this study, we focus on patients with lymphoma, and that included CLL as well. So the numbers are still small, but there's a trend across PROSECO and other similar studies, because quite a few people have now reported their data, and these are all largely antibody data. So we haven't had a chance to look at the T cells yet, although that is coming soon. So the general trends are, if I can discuss about lymphoma first, in our study we noted that patients with Hodgkin's lymphoma, if your disease has been treated and if you were vaccinated after your treatment condition, after your treatment completed, and by after I mean our data said 6 months, then we saw patients with very, very good antibody responses. This also applied to patients with high-grade B-cell lymphomas. So essentially, the patients where we could treat the disease goes into remission, then the patients receive their vaccination after the effects of the treatment have worn out, then we suspect those groups of patients will have good antibody responses. For everyone else, it's a bit of an unknown entity. So in patients with what we classically describe as indolent lymphoma, so follicular lymphoma, lymphoplasmacytic lymphoma, there is less of a relationship. So chances are, if you are on treatment, then you're probably not, and you were vaccinated during this time, you're probably not going to mount a good antibody response. But even if you're off treatment or you've never been treated, we're still seeing in select cases where the patients do not develop an antibody response, and we don't quite understand why just yet. Outside of lymphoma, so I'm kind of going across all the studies I've read, and everything has to be taken with a bit of pinch of salt, because a lot of studies are the numbers are still small. So, while someone might advertise 500 patients whatsoever, when you break it down, how many patients have a specific diagnosis, do they have it during treatment or after treatment, those numbers are still relatively small. Blood Cancer UK has an excellent initiative where they're trying to pool as much data as possible across the studies, and that's what we really need. But in the meantime, it seems, for instance, like patients with chronic myeloid leukemia, CML, seem to respond pretty well, even if they're on imatinib. The numbers are small, but encouraging. Myeloma is generally okay. Depends, again, in relationship to whether they have treatment. Daratumumab, the CD38 antibody, which is often used in myeloma, in some studies, they've shown that it may dampen the responses, in others they haven't.